Hey, welcome to another episode of Your Health and Faith Community. I'm your host, Pastor Jackie Jackson, and as always, on behalf of myself and our producer, Anita Alexander, we want to thank you for taking out time of your day to spend with us. Hopefully, we'll give you some information that will improve your quality of life. Now, you know how I am, so before we get started, you know I'm going to talk about health insurance. Have you gotten enrolled since the last time I spoke with you? Right? Listen, happy about today. We have two awesome guests. We have a mother and daughter psychologist. And let me just read their bio a little bit. I'm really excited about it. A little intimidated because, you know, it's like two PhDs in the room. So I'm going to try to do my best here. But we have doctors Kathy Ballou and Randy Ballou, and they're a mother and daughter team of psychologists. Dr. Ballou is professor emeritus at University of Cincinnati, grew up in Cincinnati. She completed her doctorate in psychology at the University of Michigan. She has conducted projects in Cincinnati neighborhoods around substance abuse treatment and HIV/STI prevention. She has co-authored and co-edited 4 books and multiple journal articles. Now, Dr. Randy Ballou has been conducting domestic and international evaluations for more than a decade. She earned her PhD in clinical psychology from the University of Michigan in 2002, completed her Emerging Leaders in the Public Health Fellowship at the University of North Carolina at Chapel Hill, and was one of 12 people selected to complete a White House Fellowship in 2004-2005. That's really impressive. Among her current projects are the evaluation of 2 OAH-funded teen pregnancy prevention programs. She has previously served as the lead evaluator for the American Association of School Administrators School Health Initiative, the New Morning Foundation school-based teen pregnancy prevention programs. The evaluation of the Illinois State Board of Elections Grow Your Own Initiative, the evaluation of the AIDS Funding Collaborative's Responsible Sexual Behavior Initiative in Cleveland Metropolitan School District, and Peer Health Exchange. Dr. Ballou also co-authored What Helps in Providing Contraceptive Services for Teens, a CDC-funded publication that was developed that was a really bad one, wasn't it? Collaboratively with the National Campaign to Prevent Teen Pregnancy, and that provides a summary of effective clinical interventions to prevent teen pregnancy. Well, Drs. Ballou and Dr. Ballou, welcome.
Glad to be here.
Excited to have you here. Do you all have a practice together in the city, or?
No, I don't see patients anymore. I do mainly research. We don't have a practice together, but we do work together quite often because we have similar research interests and other interests with regards to our community initiatives.
And I don't have a private practice. However, I am a consultant at a substance abuse clinic here in the city. I've done that for like 25 years. And my graduate students and I look at what mental health issues our substance abusers are bringing to treatment and try to work with them on both assessing those mental health conditions and also providing some treatment.
Okay, and before we jump into, because we have some very good questions, and I'm very excited about it, and I'm sure the information is going to be good, I'm just curious, before we get into the meat of everything, mother and daughter working together, and I think my curiosity is piqued on this because so often, and especially in our community, you don't always see that type of thing going on. So what is it like? I'm gonna ask you, what is it like following your mom, right, in her footsteps, so to speak,
Absolutely.
and achieving. And now you guys are peers and you work on some obviously some extremely important things to our country, to our kids, to our communities. What is that like, just working with your mom this way?
It's really great. My mother is certainly my biggest professional and personal role model and always has been. And I really have followed in her footsteps. She went to the University of Michigan, and so that's where I went for my PhD. We even had some of the same professors. And it's been really a joy to be able to work with her professionally. We don't work together full-time, but our interests overlap so much that we regularly have projects that we're able to bring each other in on. And I've just learned a great deal from her. And so I think it works very well.
This has got to be awesome. You can bounce off of each other.
Yes. Obviously, I'm very proud that she achieved as much as she has achieved. You mentioned the White House Fellowship, but also that she chose psychology. When she was an adolescent, I did not see that she would choose psychology. It was a pleasant surprise for me when she did, and as she alluded, when she got to the University of Michigan, the chair of my dissertation committee was actually on her dissertation committee, and that was very, very special.
That has to be. I'm just really impressed and find it an honor to meet you too, and to find out about your relationship as a mom and daughter and your works. That's definitely about helping people. And I love that part. But I'm gonna stop. I'm a preacher, so we can just talk and talk. So I'm gonna jump on into this. And this is about helping teens avoid risky behaviors, right? And so I'm just gonna jump into the first question here, which is, I'm gonna jump to this question about STIs, because as I mentioned when we were in the room, I had no idea what an STI was, so I had to go online and look it up. So let's talk about STIs and that issue where it concerns teens, and what is it as well?
Okay. So let me just start. STI is an acronym for sexually transmitted infections. You may have heard in earlier times, STDs, which are slightly different, but the language has changed to STI. And way back when I was a child, we called it VDs. In sexually transmitted infections, as the name suggests, they're caused by sexual contact. And some of them that you're familiar with might be gonorrhea, syphilis, chlamydia, HIV. And one of the scary things is that they don't always have early signs of having the infection. And so a person may have the infection even a long period of time before they know that they actually have the infection. And each type of infection has its own symptoms, but it wouldn't be unusual to have some kind of discharge with it. And most are treatable and preventable.
Yes, preventable being a very important,
very
important word. And so even with, as I said, we have a list of questions on here, and it's all involving around the risky behavior of teens, which I guess in all actuality could also go for the risky behavior of adults as well. But we're talking about teens. And so you have a bunch of things on here together, the HIV and the STIs, and like you said, at one point, I know back in my youth, we would say it was also the VD case along those lines. But you have them all together, and we're talking kind of two separate courses, the STDs, but we're also talking about the teen pregnancy. And so when we're combining those together, why are we combining the two?
Yeah, and we also talk about substance use too. What we know about adolescent and teen years is that it's a time in our development where we're really attracted to risky behaviors and can be really impulsive. And our brains haven't quite developed to the point where we have the resources to really manage that impulse to take risks. So for teens, we need to really provide some input and give them some strategies to keep themselves safe. And what we know about risk behaviors is that teenagers who engage in one type of risk behavior are more likely to engage in another type of risk behavior. And when you think about substance use and risk behaviors associated with sexual behavior in particular, what we know about people, not just teens, but people, is that when you're under the influence of a substance, you're less likely to make healthy choices in general. And that includes about your sexual health. So that's why we think it's important to talk about risk behaviors as a group.
And so are you seeing an incline? I mean, maybe a crazy question, but are you seeing an incline of the STIs and the STDs and all of these different things? Are you seeing an incline of this? Or?
It's really not a crazy question. Unfortunately, the data suggests that they have been increasing in recent years. And moreover, when we look at all of the states, Ohio is like the 14th highest in STIs. And wait a minute, before you get, there's more. Within Ohio, Hamilton County and Cincinnati are among the highest counties and cities within the state for STIs. And unfortunately, young people between the ages of 15 and 24 account for about 50% of all of the STIs, and young black females have a disproportionately high number. So it's something that we really need to pay attention to in Ohio, in Cincinnati, and in our communities.
14th in the country.
Yes.
You know, you always want to be high up on the list on something, but that is definitely not. And so you're saying Hamilton County, Cincinnati, Hamilton County in our state. Is there a certain reason why you think Hamilton County, Cincinnati? I'm just going to do with the state of Ohio first before we even jump across the whole country. What is going on in our county, in our city, that you think may be the reason for this?
I'm not sure the answer to that. You know, I think urban areas probably have youth who are in positions where they're more vulnerable to STIs than in other areas. But once you're in a community where the prevalence is high, it increases the chances that you will be exposed to it. If you could imagine this, I'll just use this analogy. So suppose you're fishing in a lake, and one person is fishing in a lake where there are thousands of fish, and another person is fishing in a lake where there are few fish. You're more likely to catch fish where there are thousands of fish. And so if you're in a community where the prevalence is higher, it increases the likelihood that you will actually be exposed to an STI.
Yeah, that makes a lot of sense. We're going to switch over to teen pregnancy for a minute, which I do realize that's not necessarily getting us away from the issue. But in terms of the teen pregnancy, we know it's an important issue, but give us information on the current pregnancy rate and the impact of early pregnancy.
So teen pregnancy rates have been on the decline for the past 25 years in this country, but there's still a lot of work to do. So despite this decline in teen pregnancy rates, the rates in the United States are still the highest of all of the developed countries. And even though we've seen these rates drop overall, every community has not seen the same type of drop in teen pregnancy prevention. So if you look in Black and Latino communities in particular, the teen pregnancy rate is still about double what it is in white communities. And also this decline in teen pregnancy, it seems like it's most associated with two things. One is an increased likelihood of teenagers to wait to have sex, but also increased use of effective contraceptives. And so as parents and as a community, we really need to be doing all we can do to support kids to do things that help drop these rates, like avoid sex, or if they are sexually active, using effective forms of contraceptives and using condoms, particularly for STI prevention.
So in I think I'm still on the right track here to ask this question, because I know I'm going to speak from a clergy standpoint and hearing that side where people, their attitude is you shouldn't tell the kids about condoms. 'Cause if you're telling them about condoms and contraceptive, then you're telling them it's okay to go have sex. But you're saying that there is a decrease, which is good to hear, and that decrease is in large, or a large part of that is because contraceptives are being used. So that conversation with our teens, and I'm assuming you talk to them, so how is that conversation, say, with the parents in terms of the teens using contraceptives?
So let me say a couple of things. The first thing is that it's a common misconception that talking to teens about making good decisions about sexual health makes them more likely to have sex. And the research has been very, very consistent in saying that that is not the case. The other thing that we know is that abstinence-only education is not effective. And so if you're only talking to your children about abstinence, or if they're only getting abstinence-only education, you're putting them at increased risk for teen pregnancy and STIs. In terms of talking to teens, I think parents generally have questions about sort of what should the messages be about sex. And there are a couple of things that I tend to tell parents. The first thing is that kids tend to overestimate the number of their peers that are having sex. And so it's important to correct that misinformation. Everyone is not having sex at their age. They're not going to be unique in some way if they decide that they are not going to have sex. So I think it's really important to make sure that they know that they're not alone if they make this decision to delay sexual activity. We also want to tell them that abstinence is the safest choice. It is the safest choice if you're interested in preventing STIs and preventing early and unplanned pregnancy. And then we should also tell them that if they are choosing to be sexually active, they need to use a condom to protect themselves from sexually transmitted infections, and they also need to use an effective form of contraception, preferably a long-acting reversible contraceptive like an IUD, to help reduce the risk of pregnancy. So you don't have to step away from your values. You just need to make sure that your teens have all of the information that they need to make the right decision for them.
Let me ask a quick question. Have you all done, I call it the church tour, and I always say that whenever there's someone or a group that's kind of circulating through the churches, giving information that a lot of times they don't have. Do you get called out to churches often? Have you gone and spoke? Because that, as I mentioned, I've heard that conversation so often, and I try to deal with it from the clergy side, which doesn't always, fit, because they're like, well, now you're promoting sex too, and not really getting an understanding. I think sometimes having a professional that is in your field to have the conversation is probably something that would really be good and really help.
I have not done the church tour. However, we're involved in doing a community-based intervention, and we have a pastor actually on our team. And she has been real helpful in sharing with youth that sometimes, I want to say this correctly, sometimes your religion can be a barrier to safe sex. And let me say what I mean by that. That we raise our girls and our boys to be good girls and good boys. And so if they're thinking, I shouldn't buy a condom because then I'm not being a good girl or a good boy, but then they go out and have sex anyway, and they don't have a condom on them because they didn't want, their values say that they should not have planned to have had sex. So they find themselves in a situation where they're having unhealthy or more risky sex. So it's not that the church is mainly a bad thing. The church is mainly a good thing, but it can also be a barrier to for kids in using the protection that they need. Yeah.
And that makes a lot of sense. Let me ask this question here. I saw this question here. I like this one. Are black youth using more or less drugs than other groups?
So There's something called Monitoring the Future, which is a study of 8th, 10th, and 12th graders. They look every other year at substance abuse. And the findings seem to suggest, first, that in 2017, that's when the last data were actually available, drug use was on the increase, unfortunately, but drug use among black youth, to answer that question, it really depends on the age and the type of drug. There are some drugs, like marijuana, where black youth might have been using more than some of the other groups, but there are other drugs, like prescription drugs, that black youth are using less than other youth. But the consequences for black youth are often much greater than the consequences for other youth. You know, that if a black youth gets caught with some drugs on them, the legal penalty might be much higher.
Absolutely. And unfortunately, that is the case. And I think getting that point across to our youth is, well, I guess getting points across to me when I was a youth wasn't necessarily all that easy either. And sometimes I think we need to remember, I think we look for our youth to all of a sudden think with a 35-year-old mind,
Yes.
when they're still 15. One of the other questions, what can parents do to reduce the likelihood that their teens will use drugs?
Okay. So we did a project in this community where we followed some kids. It was part of an intervention, but we followed some kids who, in the 6th grade, said they had never used drugs or alcohol. Those who said they had used, we excluded them from this particular research project. So we followed them to the 8th grade, and we looked to see among those who said they had never used in the 6th grade, who were the ones who were most likely to be using by the 8th grade. And parental monitoring played a very important role in that. You see so many times where kids say, my mother won't let me do what everybody else is doing. But then 20 years later, they come back and thank their parents that their parents, really monitored and supervised them, because that is so crucial to a child's development.
And I'll just also say that this is also important when it comes to pregnancy and STI prevention. Parental monitoring is extremely important. Kids need limits, they need structure to help them, because as I mentioned earlier, their brains really haven't developed to the point where they can tame these impulses or manage them on their own. So this parental monitoring is really important to help keep kids in an environment where it's easier for them to make better choices.
Okay, and so we're talking about the prevention, we're talking the stats on the decrease and the increase, but I think that if I was a parent of a teen, probably one of my big questions would be, okay, that's all great, but what's available? What's out there available to help me with this process?
And are you talking about around teen pregnancy or around substance abuse?
I mean around both, because I'm assuming, and based on what's going on, at some places they interact. You're using the substance, and you may be more likely to get involved in sexual activity, which could result in the pregnancy. So on both. So I guess I'm asking both doctors, what is out there for the parents to help them?
So there are a couple of things. If you can get your child into comprehensive sex education, that's extremely important. It's also important for parents to arm themselves with information. For most of us, the contraceptive choices that are available now are different than what were available when we were teenagers. So it's important that you have the information to give to your kids as well, to help them make those good choices. And one more thing I'll say is that starting at adolescence, children need private time with their doctors, so that they can ask questions about their health and get information from professionals without sort of worrying about being embarrassed about asking these sorts of things in front of their parents.
Now, when you think of substance abuse, could add on to that there are different types of interventions depending on the situation. that there's something called universal interventions, and universal interventions are for all kids, no matter what. Many people might be familiar with the DARE program in the schools. That's for all kids, all teens. But then there are selective prevention interventions, and those are for kids who live, those are effective for kids who live in high-risk communities or they're in high-risk situations. And then there are indicated prevention interventions, and those are for kids and teens who have already started using. So it would be important for a parent then to kind of know, what's the status of their particular teen? Are they using already? Do they want to prevent it before it starts? And to involve them in the appropriate type of intervention based on that teen's situation.
And I'll just add one more thing, and that is that for all of these risk behaviors, parents need to talk to their kids early and they need to talk to them often. These are not one-time conversations. You should think of this as an ongoing conversation and understand that your kids might need different things at different times in their lives because of their development or because of the types of situations that they're in.
Okay. Were you going to say something else, please?
I was just going to add that we're learning that interventions that are culturally adapted to fit a specific target group may work better than generic interventions. Oftentimes interventions have been developed maybe for a white group and then they are assumed to be appropriate for a black group, but the situation may be different, and so we need to have culturally specific and culturally effective interventions for black youth. That's one of the things that I'm passionate about, and that is culturally adapting interventions so that they work better for our target group.
And I agree with one size fits all is really not a good way to go.
Right.
We have about 1 minute, and I want to make sure that we get this question, and especially because this is a big issue right now. What are your thoughts about the legalization of marijuana?
I thought you would want to ask that. And I have mixed emotions, mixed feelings about that. Because black youth, black adults are the ones who are oftentimes penalized more, I'm happy that we may be legalizing marijuana. But the data seem to suggest that blacks still, in those states where it's been legalized, blacks still are penalized more than other groups. So it has not been the panacea for blacks that we want it to be yet.
I would agree with that. I think the criminal penalties in our communities as a result of marijuana have just been way too severe, and way too many people's futures have been compromised because of their use of marijuana. And for that reason, I think legalization makes sense for our community. But I think this is an example, as my mother was saying, about how we can't separate substance use from issues around race and also issues around the legal system. So that we need to keep our eye on the ball and make sure that as marijuana is legalized, we're still not being unduly punished for doing things that people in other communities are able to get away with.
Yes.
Okay. Well, listen, I thank you very much. I know we're out of time. I have maybe about 1,500 more questions to ask you, but I know we're not going to get there. But Dr. Ballou and Dr. Ballou, I thank you very much for coming out and sharing your information.
Thank you for inviting us.
I'm sorry. Yes, thank you. And anything you want to say before I?
Just thank you.
Thank you for having us, and talk to your children.
Yes, talk to your young people, talk to your children. Look, talk to your husband, talk to your wife, talk to everybody. In fact, you know what? Something that maybe doesn't happen a whole lot, does in some homes, just get everybody together and have a big family meeting. Listen, again, I'm Pastor Jackie Jackson. I want to thank you once again for your time. We look forward to spending time with you next week. Thank you for tuning in to Your Health and Faith community. And until the next time we're together, stay healthy, stay faithful.